Sorry I'm running late. It was such a busy clinic. I had like 4 school physicals. I hate all that paperwork. It always puts me behind.
I know. Tell me about it. I had a clinic like that last week. Anyway, I'm not sure your night's going to get any better. We have a lot of really sick patients on the floor. So here's your handoff sheet.
All right, should we start with room 1?
Sure. That's James. He's a 13-year-old with sickle cell disease. He's been here for about 2 days with leg pain. We think it's a vaso-occlusive crisis. He was admitted here last year, or 3 months ago maybe, with the same thing. His pain was very difficult to treat at that time.
Yeah, I remember he was on a bunch of different narcotic medications. I don't really remember the exact regimen.
Yeah, so we have him on a morphine PCA right now with no basal rate. I think his pain is well controlled, so you shouldn't have any issues with that overnight. In fact, we were actually thinking of transitioning him to PO pain meds, but he's on clears only now because of his respiratory status.
Wait, respiratory status? I thought he was here for a vaso-occlusive crisis.
Sorry, he actually has been tachypnic to the 30s and hypoxemic. He was on 2 liters nasal cannula O2 earlier in the day. We were able to wean him back to 1 liter, and he was actually off O2 for a little while when he went downstairs to get a chest x-ray because the nurse forgot to bring an extra O2 canister down to radiology.
Gosh, I can't believe she did that.
No, I'm not kidding, but he actually did okay. He is back on 2 liters now to maintain his stats, and I shouldn't forget, his chest x-ray did show a right lower lobe infiltrate, so you may need to repeat if his respiratory status worsens.
So do you think he has acute chest?
Yeah, I mean, he meets the criteria, although nowadays it really depends on whichever hematologist you ask.
Right?
So let's see what else. Oh yeah, he spiked his fever to 39 today. We were called about his fever during noon conference, of course, but we got the blood culture when we got back. He was a surprisingly difficult stick.
Really? How many times did it take you?
The nurse took 3 tries. I got it on my 2nd try, though.
Not bad.
Well, thank you. So, we'll have to follow his culture, see if they grow anything. He's on ampicillin sulbactam right now. Dr. Smith says this covers the common respiratory pathogens. If the culture comes back, you may need to switch him up, though.
Okay. Anything else?
Let's see. Well, the regular stuff. Watch his vital signs. He's getting pain scores. Watch the eyes and nose. He may have some electrolytes pending. So I think that's it. The hematologist number is right there if you need to call him.
Thanks.